When we talk to someone directly, we use names and titles. Good morning, John. How are you? Professor Anna, there's someone who wants to see you. When referring to people, the form of address we use depends on our relationship with them. For informal situations, we use first names only in casual or familiar settings. Example, we use first name plus surname to clarify when we are not sure if the listener knows the person we are talking about. For formal situations, we use a title like Mr., Mrs., Ms., Dr., Prof., etc., and the surname in formal situations. We don't usually use the title alone. Could you ask Mrs. Zada to call me when she gets back? We do not say, could you ask Mrs. to call me? We also do not typically use title plus first name, although job titles can be an exception. Doctor. O'Donnell, can I ask you a question? We do not say, Doctor. David, can I ask?
Now, let's take a look at the most commonly used personal titles. Mr. Used for all adult men, married or single. We don't usually write Mr. in full. Good morning, I'm Mr. Johnson, your pharmacist today. Mrs. Used for married women. Hello, Mrs. Garcia, your husband just went out of surgery. Everything was a success. Miss. Used for women regardless of marital status. Some women take their husband's surname and use Mrs., while others prefer to keep their own surname and use MS. Welcome, Miss Lee. Are you here to obtain your prescription today? Key point. When writing a title, it must be followed by a period. Mr. Smith. Not Mr. Smith.
Professional settings also have their titles. DR, used for medical doctors and people with a PhD. I will ask Dr. Johnson to review the prescription before we proceed. Prof, used for university professors. Professor Lee will be giving a lecture on drug interactions next week. ENG, used in some countries for engineers. Welcome, ENG Taylor. Are you here for the consultation on the new technological equipment?
A pharmacist can be referred to in different ways, and the appropriate title often depends on the context and the title they hold. In the United States, pharmacists typically hold a Doctor of Pharmacy degree, which qualifies them to use the title doctor in both professional and academic settings. However, how they are addressed may vary depending on the context. In professional contexts, healthcare settings, pharmacists are often addressed as doctor last name in clinical or professional interactions, particularly when collaborating with other healthcare professionals or interacting with patients in formal settings. Example: Dr. Smith will review your medication regimen today. However, to avoid confusion with physicians, many pharmacists prefer to introduce themselves as first name, last name, your pharmacist. Good afternoon, I am Sarah Willems, your pharmacist. Or simply pharmacist, last name, when interacting with patients. Hello, Mr. Johnson. This is pharmacist Cole. To improve patient engagement and trust, the title doctor is often avoided in order to foster a closer relationship with the patient.
In Colombia, pharmacists hold the professional degree of Químico Farmacéutico, QF, which is roughly equivalent to a Bachelor of Science in Pharmacy or Pharmaceutical Sciences in many other countries. In academic or formal contexts, pharmacists typically use their professional title, Químico Farmacéutico, QF, in documents. Example: Good evening. I am pharmaceutical chemist Maria Lopez, PhD. I am pharmacist Carlos Martinez, PH. It's important to note that Químico Farmacéutico does not have a direct, universally recognized equivalent in every English-speaking country, so both pharmaceutical chemist and pharmacist can be used depending on the context.
While they do not hold a doctoral degree as part of their standard education, like a Pharm.D, In the US, pharmacists in Colombia are often informally addressed as doctor in professional and patient interactions. This reflects cultural norms rather than their academic qualifications. It is common for healthcare professionals, including pharmacists, to be addressed as Doctor, a last name by patients, even if they do not hold a doctoral degree. This is a sign of respect and acknowledges their expertise. Example: Buenos días, Dr. Rodriguez. ¿Me puede ayudar con esta receta? Good morning, Dr. Rodriguez. Can you help me with this recipe? While patients may refer to them as Dr. A, pharmacists often introduce themselves simply as a pharmacist, químico farmacéutico, to clarify their role.